On.
Good afternoon, everyone. Hi, my name is Ken Sharp. I'm with the Iowa Department of Public Health. Thank you all for joining us this afternoon. We apologize for a slight delay in getting started. We wanted to make sure that we had our respective presenters on and get ourselves in order to give you the presentation today. I do have a few folks with me, and I'm going to introduce them just by name. You will hear their voices. We will not transition to them during the webinar presentation. Once we get to the slide deck here in just a moment, we will hear voices only. As we get through the slides, we do have some time scheduled at the end for some question and answer. You will all remain on mute during the event. If you do have questions, please drive those questions to the live event Q&A function, and we will publish those questions to the presenters so that we can work through those questions as thoroughly as we can towards the end of the slideshow. We will be recording today's webinar. It will be available on the Department of Public Health website early next week, so that if you have peers who want to visit this information, they can certainly do so. So with that, let me just do some quick introductions, and then I will transition to the slide deck. With me today is Bethany Kinty. Bethany is the vaccine program coordinator in the Bureau of Immunizations and Tuberculosis. She is a immunization nurse and has been with the department a number of years and is a key team player here on sharing vaccine information. Also with me today is Don Callahan. Don is the Bureau Chief for our immunizations and tuberculosis. The two of them will be talking a fair amount today about the allocation process. And then Rebecca Curtis is with me as well. Rebecca is kind of a team lead for us, and she is the Bureau Chief of Emergency and Trauma Services. Director Garcia is working through some technical difficulties. She hopes to join us. She will be with us if she can. She is the interim director of the Department of Public Health, and when we have her join us, we will give her a few moments to share any comments that she wishes. So at this point, Rob, I think we'll go ahead and transition and put the slides up on the screen, and we'll begin to work our way through the slide deck today. Okay. So as I've introduced myself, Bethany, Don, and Rebecca, we will get transitioned here to a few slides. Oops. The purpose of today's meeting really is to just try to set the stage for the business and agricultural sector across the state, to give you a better understanding of where we are with vaccine allocation and administration, and how we anticipate this vaccine campaign will roll out to your respective industries. We do want to provide you the most current information regarding the allocation, distribution, and administration of the vaccine in Iowa. I will just qualify with this slide that information changes daily, and it changes swiftly, and it changes fairly extensively. I also want to set the stage that today there will be a lot of information that you hope that we have that unfortunately we do not have. But what we will do today is give you as clear a vision of what information we do have, and we will give you an idea of the next steps. And we're going to walk away today with some recommendations for what you can do now and give you some idea of what you can expect in the coming weeks and months as we begin to reach your populations. There are some key terms that we wanted to define. We will refer to these very casually in our world in public health. These are very common terms to us, but we did not want to assume that you know these terms offhand. So CDC, the Centers for Disease Control and Prevention, that is a key federal partner for us as we roll out the vaccine campaign. You will hear me talk a little bit later about the Infectious Disease Advisory Council and the recommendations that they have and will continue to make for priority populations to receive the vaccine. You'll hear us refer to them as IDAC. The Immunization Registry and Information System, IRIS, that is the information system that we use to collect information regarding vaccine administrations in the state of Iowa. You will see some acronyms of local public health. So that is your local public health agency. It's typically assigned under the County Board of Health. And then you will hear us refer to pods or points of distribution for vaccine, or in other situations it may be for other medications, but for the purposes of today's discussion, it is within context of the vaccine administration process. So at this point, I'm going to turn this over to a tag team to Don and Bethany to walk through the next several slides. Don and Bethany, just let me know when you're ready to advance to the next slide, please.
All right, thank you, Ken. Hi, everybody, and thanks for the opportunity to speak to you this afternoon. This is Don Callahan. I'm the Bureau Chief of the Immunization Program, and I want to give you a little background and information about the National Vaccine Distribution Plan for the COVID vaccine. So COVID vaccine will be allocated by CDC and the Operation Warp Speed group to Iowa based upon population size and target population. So Iowa gets its fair share based upon its population size. Iowa healthcare providers who intend to provide COVID-19 vaccine will be required to complete a COVID-19 pandemic vaccine provider agreement. This is a federal agreement that we're actually distributing and collecting here in the state of Iowa. All healthcare providers that choose to complete a COVID-19 pandemic provider agreement to administer the vaccine also must enroll in the state's immunization registry information system. And that is how we are allocating vaccine to all of our healthcare providers in the state of Iowa. Next slide, Ken. A little more information on the vaccine provider agreement process. We are utilizing a survey tool called REDCap to document organizations' agreement and acceptance of the terms and conditions to become a COVID-19 vaccine provider in the state. I'll show you that link a little bit later on so you can find that if you so choose to become a COVID provider. Also, each vaccine provider agreement requires the organization to have a medical director for that organization to become an organization that can administer vaccine in Iowa. Each vaccine provider also must have the capabilities to appropriately and store, maintain vaccine. The two vaccines that we currently have available do have different storage requirements, and Bethany will discuss those a little bit more on some upcoming slides. Next slide, Ken, please. A little bit more about who can become provider agreements. So we can have industrial occupational health facilities that meet the agreement requirements and are eligible to enroll and complete the COVID vaccine provider agreement and become vaccine providers. Those healthcare providers and organizations who enroll in IRIS and complete that provider agreement are not obligated to provide COVID-19 vaccines. In addition, enrollment into IRIS and completing the COVID provider agreement does not guarantee the receipt of pandemic vaccines. Just to give you a little update on the number of providers that we currently have enrolled in Iowa, we have 1,654 enrolled providers as of this morning. 193 of those are federally qualified health centers and rural health clinics throughout the state. Of course, all of our 99 local public health agencies are enrolled. We do have hospitals enrolled, as of right now, 112. We do have long-term care facilities also enrolled, private healthcare providers in the total of 449 right now, and then we also have 512 pharmacies that are enrolled throughout the state. Next slide, Ken. This slide will provide you the details to become a COVID provider if you meet those requirements. The first link will take you to the department's COVID-19 vaccine webpage, and it has information to become that COVID provider. Also, that bottom link is a direct link into the REDCap survey, which we're utilizing to capture that information on becoming a COVID provider. I will turn over the next slide to Rebecca Curtis. Rebecca?
We want to talk just a little bit about the process that we are using here in Iowa to allocate to the COVID-19 vaccine. So we've talked about the immunization registry. So what happens from start to finish is the CDC and Operation Warp Speed electronically allocate doses to the Iowa Department of Public Health electronically through the IRIS system into the registry. As Dawn mentioned, our allocation numbers are based on priority populations, where we're at according to our current phase. And then after that step, and we receive those numbers, IDPH then determines the dose allocation per pro rata by county, and then provides those doses into the local inventory. And then IDPH, as I mentioned, makes the electronic allocations to local public health. Can you go to the next slide, please, Ken? At that point, then, local public health then makes the decision on how they will allocate those doses. They may keep some of the doses themselves to administer, or they can allocate those to the vaccine providers that have completed the vaccine provider agreement that Dawn just talked to you about. If local public health keeps those, a number of those vaccines that have been allocated, for themselves, they can have open or closed points of distribution, or those pods that Ken talked about early in the presentation. And they determine what pods or points of distribution depending on the priority populations that are being targeted at any point of time. Local public health can also allocate doses to hospitals or clinics for closed pods to vaccinate priority populations such as healthcare workers, or local public health may also allocate to other community partners such as pharmacies or industrial vaccine providers for those closed priority populations. Next slide, please. Thanks, Ken. So just a little more description of what a pod means. These points of dispensing, local public health agencies have been working on pod planning for going on almost 2 decades. Typically, these pods are community locations at which these local agencies then dispense and administer medical countermeasures to the public, such as vaccines. Local public health have been planning for using 2 typical types of pods, one being an open pod and one being a closed pod. Open pods are generally located in public venues to dispense or administer vaccines or medical countermeasures to the public. Closed pods are typically planned and at sites that are staffed and managed by individual organizations in collaboration with the public agencies to dispense these medical countermeasures or vaccines only to their own population while continuing operations during a public health emergency. So these closed pods could be at large business settings or industrial settings or manufacturing settings. Open and closed pods typically are done simultaneously and planned simultaneously by the local public health agencies. So reviewing what I just walked through, so large manufacturing plants, large processing plants, other large employers that would possibly be interested in having or hosting this type of point of dispensing. Those questions, those collaborations need to happen at the county level with local public health. And Ken will talk some more at the end of the presentation about the best mechanisms to work with your local public health agencies related to these points of dispensing. But these are, as we talked about, just typical types of dispensing models that local public health have been planning for to be able to dispense these types of medications. So I will turn it back to Bethany.
Good afternoon, everybody, and I think I probably have the most exciting part of this presentation to talk about. December was a big month. We had 2 vaccines for COVID-19 that received emergency use authorization was granted by the FDA. Pfizer was the first vaccine that came forward to receive their EUA, and they received it on December 11th, and Pfizer Vaccine arrived in Iowa the following week. Pfizer Vaccine is a 2-dose series that is given 21 days apart. We do have a grace period of 4 days, so we can give it as early as 17 days between the 2 doses. While we want everybody to come back in right away as early as possible to receive their dose, if people do go past the 21 days, we never need to restart the series. The important thing to remember is for COVID-19, the series, it has to be completed to be effective. This is a new vaccine, and we just don't know the efficacy of the single dose yet. They just haven't been evaluated. Pfizer has a unique challenge. It has to be kept frozen between -80 degrees Celsius to -60 degrees Celsius. That's not a common temperature that freezers that a lot of our local public health and healthcare providers have. So that is a little bit of a unique challenge with Pfizer. Next slide, Ken. Moderna Vaccine came to receive their emergency use authorization on December 18th, and we did receive Moderna Vaccine in Iowa the week following. It was a nice Christmas present. This is a much more typical vaccine of what our vaccinators are used to. It again is a 2-dose series that is administered 28 days apart. We have that 4-day grace period on either side, but we never have to start the series again if someone comes in after that 28 days. Again, both doses of this vaccine are necessary for protection, so that's probably one of the most important things I can stress. People who receive their first dose of vaccine, to receive that full protection, they need to come back in and receive that second dose of vaccine to complete that protection. Moderna is actually stored in the freezer, much like our varicella vaccine that our healthcare providers are used to storing, at a -25 to a -15 degrees Celsius. Next slide, Ken. And along with the vaccine are ancillary supplies. And ancillary supplies have been procured and distributed by the federal government, and this comes at no cost to our healthcare providers in Iowa. They arrive before the vaccines or the day that the vaccines are arriving, and they include needles, syringes, alcohol prep pads, a vaccination card for every person that they can write down the date they received the card and what vaccine they received, surgical masks, and face shields. The ancillary supplies do not include sharps containers, gloves, or bandages. So those are 3 items that healthcare providers do have to provide. Next slide. And Ken, I think I'm going to kick it back to you to start going over priority groups.
Yeah, thank you, Bethany. I do see that Director Garcia has been able to join us. Kelly, our apologies for the technical difficulties. Always technology challenges, it seems, nevertheless. Are you able to hear us okay, Kelly? And if so, I think before I get into the priority groups, I'll give you an opportunity to speak to the audience today. Okay, Kelly, I think you are
nope,
still.
I unmuted Ken, and it takes a bit for it to actually work. So I apologize,
Okay.
everyone, for the technical difficulties. I think Teams is overriding my account at the moment, and I might need to shut down my computer again. But thank you. So I heard you say that before you move into priority groups, you're going to turn it to me. I just want to thank everyone for joining this call today and the partnership with our 2 agencies in this effort. You know, I think the goal of today is not only to give you some education around where we are and where we're headed, obviously allow you to ask some questions and for us to answer. I think the things that I want you to think about today is to really, you can't hear me?
Yes, we can.
Oh, okay. my assistant came in and said they can't hear me. So, I really want y'all to think about the time that you have between now, when we are focused primarily on healthcare delivery, which is incredibly important to make sure that our hospital providers and our clinicians stay online to serve all Iowans and their healthcare needs, and especially in the COVID response. But that you use this time to be thinking about talking with your own employees, that you are talking with them about their concerns, their questions. You're thinking about how you are going to administer this dose, perhaps on site in your own setting, and that you're building those relationships with your local public health partners, which doesn't mean that at the end of this call today you pick up the phone and call them, but does mean that you really think about how you're going to be helpful in this delivery. We need you. It is our goal with our allotted supply to move as fast as possible and as targeted as possible to really quell the spread of this virus. So again, thank you for the time today, and we are going to be ready to answer your questions, but I'm going to turn it back over to Ken so that you can talk about priority groups.
Great. Thank you, Kelly. Appreciate your comments. So as Director Garcia had indicated, I do want to begin to walk you through some of the discussions regarding priority groups, where we are today, what the future looks like and some kind of understanding of the challenges of being able to answer precise questions today about when you will be eligible for your vaccine. However, we do hope after this you have a keener appreciation and understanding of the work that we have ahead of us, and you have a better understanding of, generally speaking, the sequence of which you can expect to be eligible for the COVID-19 vaccine. So as we know, the public demand for COVID-19 will continue to be high, and we are at a period of time still where there is a shortage of vaccine, while there is also pretty severe disease trends in the community. We are at a point in time early in the allocation process where manufacturing hasn't caught up with demand, and it will take us some time to have manufacturing catch up with that demand for the vaccine product. Our decisions as we move through eligible priority groups will be based on vaccine supply, and the reality today is we do not have a clear vision and a clear timeline for when and by how much that vaccine supply increases. We'll be watching things like the illness severity and impact, and we'll be taking into consideration the potential for disruption of community critical infrastructure. As we look at the recommendations that are coming from our federal government, and within CDC there is this Advisory Committee on Immunization Practices, or ACIP, and the National Academy of Medicine. Those organizations are providing recommendations for prioritization of populations, and they are taking into consideration things such as critical workforce, which most of your industries obviously fall into. In terms of essential functions of society, that critical workforce also is inclusive of the healthcare personnel. And then we also have some prioritization as it relates to staff and residents in long-term care and assisted living facilities. And we have prioritizations on populations of age that have the most severe outcomes in terms of the illness. To help us look at the ACIP recommendations and how those federal guidelines should be applied in Iowa, Director Garcia established in December the Infectious Disease Advisory Council, or IDAC as we know it, and that is a team of appointed external and internal subject matter experts that have expertise in clinical settings, socioeconomic considerations, health equity considerations, and other important variables and factors as we consider how to apply the ACIP recommendations in Iowa. So I'm going to spend a little more time to kind of talk about the role of IDAC and how that has influenced our current status and the current population that we are focusing on, and how we will continue to use IDAC as we begin to look at the next phases of allocation for eligible populations. As I mentioned earlier, IDAC is assisting us at the State Health Department provide guidance and prioritization of populations for these early stages of vaccine allocation. We know as we look at the vaccine eligibility list for healthcare personnel and long-term care residents that we simply do not have enough vaccine that is coming into the state on a timely enough fashion to get everyone vaccinated in a short period of time. So we must work through some prioritization so that we can drive those vaccines to the populations that help us ensure the best possible outcomes. It is comprised of both clinical and ethical expertise from across the state. I won't list all of those specialty skill sets that are listed here in that second bullet. You can certainly read those. And IDAC is developing recommendations for prioritizations within these critical populations of healthcare personnel, critical infrastructure workers, essential workers, and people at increased risk for illness as we work through the priority populations. In December, the Department of Public Health, under Director Garcia, issued something called a vaccine shortage order. That vaccine shortage order is a legal mechanism. It's a tool that the state health department has during times of pandemic or other public health disasters to allow us to direct the use of limited resources. And in this case, vaccine is certainly a limited resource in high demand. And that vaccine shortage order went into effect in December to say populations in phase 1A as defined by ACIP and further modified by IDAC are the only currently eligible populations to receive the COVID-19 vaccine. That population is largely defined in two sectors. One is healthcare personnel with patient exposure. The second is residents of long-term care settings and the workers of those settings. To help us further prioritize that, when those vaccines started arriving about the week of the 14th of December, we knew that there was more demand within the healthcare community than what there was vaccine arriving in the state. So as we looked at how to further define that, IDAC came in to provide clarification that healthcare personnel should be inclusive of paid and unpaid persons serving in healthcare settings who have the potential for direct or indirect exposure to patients and infectious materials, healthcare personnel working in residential or long-term care centers, and then skilled nursing facilities residents. IDAC then also offered some additional factors that need to be considered as local public health agencies and vaccine providers prioritize who received the vaccine first. And so what IDAC suggested and what is now in requirements through the vaccine shortage order is to identify healthcare providers who have the highest risk of exposure and the highest risk of complications from exposure. They should receive priority population. To further evaluate that risk, facilities needed to take into account the risk of the exposure to COVID-19, the frequency of the exposure to COVID-19, the immediacy of exposure, and the duration of exposure. And so I'm going to cover this third bullet, and then we'll kind of give you some practical applications of how this is being applied. And I want to use this as an example for what we are expecting to see as part of the recommendations for phase 1B and 1C, and I will get to those in just a moment. In addition to these risk factors that are in the first two bullets, the other thing that vaccine providers looking at healthcare personnel needed to consider, we want to be sure that we don't have a narrow definition of healthcare personnel so that we define only licensed physicians and nurses, for example. We know that it is important for the healthcare system to operate. We have a full spectrum of staff who have exposure and interactions with patient. That may be food service staff, that may be housekeeping staff, that may be the front desk receptionist who's receiving patients, or any other spectrum of healthcare workers that work in that environment and have exposure to patients. We also want to make sure that it's understood that this is not just about paid staff, but it is also inclusive of volunteers, students, and others who may be in that environment so that we can ensure the operational security of the healthcare system. The second half of this priority is the long-term care population. In Iowa, we have partnered with the National Pharmacy Long-Term Care Program. They have been vaccinating these populations, the skilled nursing facilities and assisted living facilities, both residents and staff, since the week of December 28th. And CVS, Walgreens, and community pharmacy are handling those populations directly in lieu of asking local public health or others at the local level to manage that product. So for practical purposes in Iowa, where we are driving most of our efforts, and I'm going to back up one slide, is in this healthcare personnel setting. This is our current target population and will be for several more weeks to come. To apply this set of standards, I'll give you a couple of examples that we have worked through. So as we watch hospitals in Iowa begin to prioritize their healthcare personnel, it would make sense using this criteria for emergency department staff and ICU staff who are dealing with the most ill patients and most acutely ill patients would be among the first to receive vaccine, assuming the supply is limited. So in those ICU settings, this is not just the physician and the nurses, but it is inclusive of staff who are coming in and bringing food trays, who are coming in performing house cleaning purposes, etc. It might include HVAC personnel who are in the room for service purposes or other reasons. And so we are asking those hospitals to think about that full spectrum of staff and prioritize those staff who have the most acute exposure to COVID-19 patients. And those individuals should receive priority over an individual who perhaps is working in the pediatrics floor with no exposure to COVID patients. So the prioritization is being applied locally, and it is really, again, focused on that risk of exposure and the risk of consequence. So I want you to take that experience and that application and start to think about how we are moving and planning for what we are calling Phase 1B and Phase 1C. The ACIP that we talked about from CDC, the Advisory Council on Immunization Practices, came out earlier this, well, at the end of December, with recommendations for a Phase 1B population and a Phase 1C population. In both of these phases, there is an age-based component and separately an essential workforce component for workforce that is essential for societal functioning. So we want to talk through these kind of at a very high level, and then I'll kind of give you an indication of what we expect to have from IDAC next week. IDAC has been meeting weekly on Monday afternoons. We have had at least 2 meetings of IDAC regarding the ACIP recommendations for Phase 1B and 1C. Phase 1B from ACIP identifies what is termed as frontline essential workers. These are non-healthcare workers, but individuals such as food and agricultural processing, manufacturing, first responders, and others, and persons aged 75 years of age and older are recommended for that 1B population. These are 2 separate and distinct populations. It is not a requirement of both elements to be in place to be included in the eligibility criteria. We will get to some further delineation of what we expect to see from IDAC next week. Phase 1C is also has 2 parts to this. It is an age-based approach. So they are looking at anyone age 65 to 74 or persons that are 16 and older with medical conditions that increase the risk for severe COVID-19. So those are the 2 criteria related to age-based prioritization. And then we have kind of the rest of the essential workers not previously identified in Phase 1A or 1B. And so as we look at that population, things like transportation workers and some others start to fall out in that recommendation. We want to be very clear. IDAC has not yet finalized the Phase 1B and 1C recommendations. We expect that next week. They will, we fully expect them to finalize that recommendation next week. We've been working with them for several weeks now. We do expect a finalization next week. The one thing that is important to understand, despite IDAC presenting a recommendation to Director Garcia and Dr. Padati next week, that will not in and of itself transition us to phase 1B allocations. This is simply a signal that this is the next population that should be eligible when vaccine supplies are sufficient to begin vaccinating this population. I mentioned to you earlier the tool that we use as a vaccine shortage order. That vaccine shortage order, as I mentioned, is a legal document that restricts the use of vaccine to populations currently in phase 1A. At such time after the IDAC recommendation that we have sufficient supplies of vaccine, we will update the vaccine shortage order to be inclusive of the 1B population and any remaining 1A population that did not yet get vaccinated. You can watch for updates to the meeting minutes and the recommendations. We expect IDAC to vote on those recommendations on Monday. There is a chance that it may take us a day or two later to finalize the recommendations and get them posted. But once the recommendations have been submitted by IDAC to the department director, they will be posted on this website. That will give you an opportunity to begin looking at where your respective populations fit within the prioritization, but that does not mean that next week your populations will be eligible to receive the vaccine. So we anticipate two kind of general questions. The first is, as a business in Iowa that thinks that we are eligible likely in phase 1B or 1C, what can I do now? Our first request of everyone is to first please be patient. There is a tremendous amount of pressure on the public health system right now for the vaccine. Our biggest limiting factor is we don't have enough. When we get it, we are very confident that we will be able to get that vaccine out and into arms to the population that we are attempting to target. We also want to put into perspective that we have been working on phase 1A since the week of December 14th. We think we have several weeks left yet to finish that phase 1A population for the entire state. Once we feel that we have reached enough of that population where our supply of vaccine exceeds the demand of vaccine for the 1A population, we will then transition to eligibility for phase 1B. Once we reach phase 1B, it is likely to take several months to reach both 1B and 1C populations, again, entirely dependent upon what we receive in the way of vaccine allocations from the vaccine manufacturers. As Bethany had indicated earlier, we currently have only 2 approved vaccines. There is clear indication that we have more vaccines coming in the next several weeks to a couple of months, and that will help alleviate some of the demands for the vaccine and the shortages that we're experiencing. So please be patient and understand this is a weeks and months long process, and the higher the risk and the higher the impact your workers have on societal functioning and the higher the risk they present in terms of their age, the sooner in the process they will be eligible. And we understand everybody's anxious to get that, and we are working as hard as we can to get vaccine to you when you are eligible and the supply meets that demand. The second thing that we would highlight, Dawn talked earlier today about vaccine provider enrollment. If you are an employer that is a large employer and has many employees in a single setting or a congregate setting, and you have an employee health program, we would ask you to consider enrolling your employee health program as a vaccine provider if you qualify. That will make you eligible for your county to make some allocations to you at a point in time to help with that vaccination effort. And if you have a desire to do that, there is some information on our website for vaccine provider enrollment. The third thing that we ask you to do is continue to monitor the Department of Public Health website. That is, I believe that was included in the information that we sent out regarding the webinar. There were a few links at the bottom of that email. There are some key resources there. You can watch for the IDAC recommendations. There is a tremendous amount of information available to the public, and that will be an excellent resource for you to continue to watch. The fourth thing that we ask, we did mention earlier, I think Rebecca discussed the allocation process is through our local public health agencies. Please understand our local public health agencies are incredibly busy right now. I'm asking you to please not hang up the phone today and pick up the phone and call your local public health agency. They will not be able to help you today. But what I would say is look to see if they have information on their website and watch for information on communication that they may be sending to their businesses and communities as they begin to plan for their vaccination efforts for when we do turn on the phase 1B population. Again, I just reemphasize local public health is overwhelmed and they are telling us please ask people to be patient and not call us right away because we don't have answers for you. And as soon as they have answers and they have timelines, they will be in a position to communicate that. So I know that that's very frustrating to hear. I know that that's difficult to be patient and wait for that information, but that is vitally important. The other thing that you can do is to begin thinking about the population that you have, some of the numbers that you may have, and begin to compile that information and the workforce type that you have so that when local public health does reach out to you or they start communicating to the community about eligible populations, you are ready to communicate your need to that local public health agency. These things are probably the most beneficial use of your time, and it helps us in public health be more efficient when we are ready to start providing vaccine to you. The next question we expect to see, and I've seen some of these in the Q&A, is when and where can I get my vaccine? I'm sorry, the short answer is I don't know precisely when that will happen. And that is just as clear and candid as we can be, but it should be coming in the next weeks and few months. And we are confident that we will get there. It is just going to take us some time. Again, it's hinging very heavily on the manufacturing of vaccine and the addition of additional vaccine manufacturers. So a couple of things that we want to clarify. The work that you do and the environment that your workers are in, along with the age of that workforce, will have an impact on where you fall within the overall prioritization. As I mentioned earlier, age is a component of each of the Part B and 1B and 1C. In addition to kind of the higher risk work environments that are also important to societal functioning. So for example, if we look at the meat packing or the agriculture industry, ag and food industry, we know that the meat packing industry experienced some pretty significant impacts early in this outbreak. So we are looking at prioritizations for congregate workplace settings. And we expect IDAC to have some comment to share about how congregate settings impact the prioritization within that overall workforce. So continue to watch, be thinking about the prioritization of where your workforce may fall. Think about how their work environment may place them at a higher or a lower risk of exposure and transmission of disease, and that may give you some sense. The higher that risk, the sooner you will be eligible. The lower that risk, the longer it's going to take us to get to you in terms of your eligibility. As I have said several times, the biggest limiting factor at this time is the availability of vaccine. To give you some sense of the vaccine supply that we are working with, as it currently stands today for the healthcare population, we have only about 18 to 19,000 doses each week delivered to us for the entire state of Iowa. As we get to the end of January, those numbers will increase. They will increase at least by double because of some other variables that we do know, but beyond that, we do not know how much we will have as we approach the end of January, and when that will influence us being able to transition to phase 1B. As soon as we do have better ideas in terms of that transition and timeline, we will begin working on updating that vaccine shortage order to be inclusive of phase 1B, and then eventually update it to include phase 1C if necessary. And we will communicate that through media and through local public health so that they can begin working on providing those vaccine options to you. I also wanted to, Rebecca talked earlier about pods, the points of distribution or points of dispensing. There's a few typical ways that this might happen, particularly if you are a large employer and have a large employee base. There may be some different strategies for you. If you are a smaller employer and have employees spread kind of far and wide, there will be perhaps different approaches that make more sense for you. But some typical delivery methods that we might expect to see, and this will be largely dependent upon individual counties and their final decision making. We do know that there are large employers who will be offering closed pod vaccine clinics only for their employees. Those large employers will be working with the county health department to be eligible for and receive vaccines, so that vaccine provider agreement that is managed by the employer's employee health system vaccinates their own employees. And that will be the only individuals eligible in that type of a setting offered by the employer. Another typical scenario that we might see would be local public health actually offering a pod vaccine clinic for the eligible populations. So it may be determined, for example, transportation workers are eligible. Well, when you start talking about transportation workers and think about the various modes of transportation that might be inclusive of, that may be a fairly widespread population, and the county public health agency may decide that they're going to set up a vaccine clinic for transportation workers for a given week and ask people to come in, bring in an ID, and obtain their vaccine. The final option or final scenario may be kind of a hybrid where the employer and the local public health, by coordination with a third-party vaccine provider, such as a local pharmacy or healthcare provider, offer the vaccine to the eligible population. We are seeing this for those of you in the metro area. There's been some news coverage recently out of Dallas County about providing vaccine to Hy-Vee, so that Hy-Vee can offer vaccine to unaffiliated healthcare personnel that do not work in a hospital setting. So we can see where that type of a scenario would also make sense for certain industries. So that will give you an opportunity to kind of be thinking about and expecting how this vaccine may become available and where you might begin to receive it. So that does conclude our webinar for today. I do want to take a moment. It looks like we have over 50 questions that have been moved into the Q&A session. So I'm going to take the next roughly 30 minutes to try to navigate through some of those questions. And I will just moderate those questions from here and defer to my team members as appropriate to answer those questions. So the first question is, I'm 66 and driving a delivery truck. When will I be eligible? As I've alluded to, we don't have an explicit date, but certainly based on the data that you provided, you would fall within that 1C priority group. So it will be likely a few months yet before a 66-year-old delivery truck driver would be eligible. Audiologists, when are you able to get the vaccine? That's one of those kind of gray area questions in terms of patient care. We think that you would likely be eligible kind of towards the tail end of phase 1A as a healthcare provider, having direct interactions with patients. Obviously, generally speaking, we would expect your exposure to be lower, but certainly an important part of the healthcare system. So again, watch for clinics or opportunities available through your local public health agency for healthcare providers outside of the hospital setting. There is a question here and it's been answered, but we will just reiterate that. Is this being recorded? Yes, it is, and it will be placed on Iowa Department of Public Health website early next week. Dawn and Bethany, I'm going to turn to you here. There's a question about, is there a listing of the vaccine providers in the state of Iowa? Can you direct folks to the right location? Yeah,
thanks, Ken. When we have additional doses of vaccine available, we'll be utilizing a website called vaccinefinder.org. Healthcare providers will be able to go ahead and open their clinics up to the public, and they can identify that they have vaccine available on their clinic hours. So that will be coming soon. Also, I would recommend that you look at your county public health agencies' web pages. They'll be posting information on those web pages as well in the future.
So there's a question here, will those employees who have been deemed essential be given their own unique population and staging in the receiving the vaccine? So as I covered some of the typical options, there will be some variability depending upon the county where your business is located. And it will oftentimes be dependent upon how large your business is. What we might expect as we get into some of these broader populations of 1B and 1C is that there will be community clinics perhaps available through the pharmacy. There may be some dedicated clinics offered by local public health or healthcare where local public health partners will be advertising and sharing information about what populations can show up and where they can show up to receive their vaccine. So again, the information here is really important to watch your county health department and the county of residence for information about how to access that vaccine once you are available. Question, I'm a 36-year-old, I run a restaurant, are we going to be available to the vaccine? Yes, the restaurant food service industry right now, it looks like they will likely fall in the 1C population, but keep an eye out for two things. I would recommend you look up the ACIP recommendations on the CDC website for phase 1B and 1C populations. And then keep a close eye on the IDAC recommendations on our IDPH website. There's a question of how many vaccines is Iowa currently receiving per week. I've already addressed that. Currently available to local public health for healthcare professionals is only about 18,000 to 19,000 doses each week, and that's for the entire state. Is allocation to long-term care facilities outside and apart from the system now being described? That was at 252. So let me just try to clarify that the long-term care program offered by the National Pharmacy Program is being handled by CVS, Walgreens, and community pharmacy. And for the most part, local public health is not directly involved in offering those clinics. So it is a separate but simultaneous effort, and it is being managed by the national pharmacy chains that I mentioned. Any stats on the number of higher education institutions registered as vaccine providers? Don, do you have something for that?
Ken, I don't have an exact number, but we do have some enrolled now. And then as we transition into the other phases, your 1C and opening up into phase 2, I anticipate we'll have more of those institutions that will be enrolling. So our enrollment is open throughout the rest of the year. We're not closing our provider enrollment, so any provider that wants to enroll throughout the year can do so.
Thanks, Don. So there's a couple of questions here. Can an employer with approximately 100 employees have a closed pod set up? I think some of the answer to that will depend upon where that 100 employee facility is located. If that is in a very small county, it may well be likely that it would be a closed pod setting. That would be an option to you through that local public health agency partnership. If you were in, for example, a Polk County setting, that may be a small enough population, relatively speaking, to a Polk County arrangement where there may be more of an open pod for like employees to receive their vaccine. The bottom line message here is, as we get farther into the phase 1A population and when counties start asking for additional planning efforts from the business industry within their community, those conversations will be important at that time. But again, I please ask, don't hang up from here and start calling your local public health agency. They're very, very busy with vaccinating that 1A population. Keep an eye out for information on their social media pages, their local website, and perhaps at the end of the month, start making some contact with that local public health agency. Regarding closed pods, how will distribution be determined? Rebecca, I'm going to give my voice just a bit of a break. Do you want to talk about how closed pods and the allocation will be managed?
Sure. As you mentioned, any type of point of dispensing or distribution is going to be managed through coordination with a local public health agency. So the vaccine will be distributed to the local public health agency, who then will coordinate and collaborate with the organizer of the closed pod, so to speak, to determine if the distribution of the vaccine will go directly to the business, as if they're a vaccine enrolled provider, or if local public health will be allocated the vaccine doses and take it to the closed pod. There's any number of models that can be used, and any business that would be considered essential. But again, as Ken described earlier, it's all going to be dependent on what the capacity of the local public health agency is once they get to this point, and then are able to have the conversations about the closed pods.
Thanks, Rebecca. So the next question, are teachers and childcare workers in 1B? Yes, as we talked about the priority populations for the frontline workforce with IDAC, they did call out K through 12 and childcare staff. So we do expect them to be within the 1B population. Again, we'll be working to prioritize and provide some guidance on what their relative exposure and risks are, but we do expect that population to be within the 1B population for when that eligibility does become open. Across Iowa, are the vaccines being distributed per capita, or are they being driven by populations targeted? So let me talk about that. That's a great question, and that is a very fair question. So as we look at the targeted populations, what we are working to do is to access information about the number of individuals that are in that targeted population. And for the most part, many of the populations that we are targeting are allocated or distributed evenly across the state of Iowa, very consistent with the census population of the most current count. So if your county has, say, 2% of the state's population, it's likely that you have about 2% of almost any of these given workforce priority populations. However, as we are currently watching, the largest counties in Iowa obviously also have the largest numbers. When we look at, for example, a Polk County with multiple major healthcare systems, or a Johnson County with the University of Iowa hospitals and clinics, if we try to look at the population-based allocation of healthcare workers in those counties, those major employers draw employees from multiple counties from across the region. And so there will be times when a straight population-based allocation does not work, and we at the state level work to intentionally drive vaccine to those major employment hubs to ensure that we reach that intended population. So generally speaking, our allocation process will start with a population-based allocation pro rata per county. But as we watch, and if we see very special targeted populations that we are trying to accomplish, another discussion point that we've had is, for example, meatpacking plant workers. We know that if we're going to try to get all of the meatpacking plant workers, for example, in a short period of time, we will need to drive vaccine to very specific areas and not use only a population-based approach. So it is multidimensional. We are looking at those numbers every single week and making our best judgment on how to reach those populations in a timely fashion. The other thing that I mentioned earlier that goes in part with this, we are trying to keep the entire state in about the same stage of eligibility. So as we begin to see the phase 1A population vaccinated and vaccinated sufficiently that the demand for vaccine is low, we will begin to turn on phase 1B to fill the supply that's available to us with the vaccine that's not being used for phase 1A. So it will be kind of a dimming of phase 1A, a brightening of phase 1B to meet the supply and demand chain as that vaccine comes into the state. So Bethany, I'm going to turn this question to you. Is it safe to get the second dose from a different manufacturer than the first dose?
Thanks, Ken. So we want you to make every effort to finish the series with the dose that you started. So if you started the series with Pfizer, I would want you to come back at the appropriate time and finish the vaccine with Pfizer. However, what we have been told is both of the COVID vaccines that have the EUA right now are mRNA vaccines. And so if you would happen to be vaccinated with Pfizer and have your final dose with Moderna, doses do not have to be repeated.
Thanks, Bethany. While I've got you there, I'm just going to jump a question. Are pregnant women eligible for the vaccine?
Absolutely. CDC has a really nice page now for vaccination considerations for people who are pregnant and breastfeeding. Both of the COVID vaccines are inactivated vaccines, so yes, pregnant women are eligible to receive the vaccine if they fall in the population currently being vaccinated.
Thanks again, Bethany. The next question I'm going to address is, will there be a database that provides information on individuals who have successfully received the vaccination series? I'm going to provide a point of clarification here. If you as an employer are trying to determine whether or not your employee has received a vaccine, there is not a place for you to go look up, and we cannot provide that information to you. It's confidential data that we cannot release. If the interest is trying to look at where the state is overall for vaccine administrations, starting on Monday for sure, we will be posting on the coronavirus.iowa.gov website a vaccine administration visualization that will show you how many vaccines have been administered in the state, and then a breakdown by county of how many vaccines are administered within that county. I do want to come back, if as a health or as an employer, if you have an employee health program and wish to become a vaccine provider so that you can have some better understanding of the acceptance rate within your facility, that is certainly an opportunity that will give you more direct access to the acceptance rate within your facility. So just maybe some points of clarification there. Again, a lot of it is dependent upon the intent of the question. The other thing that is an option, we get a question oftentimes that's related to that. Can I mandate that my employees take the vaccine? Our recommendation is you need to talk to your legal counsel. There's a little bit of conflicting information exactly on how that's interpreted. Don, are you coming to the mic to speak to that?
Yeah, Ken, also vaccines that are under the emergency use authorization cannot be mandated is what we are being told.
Okay. So to that question, I think ultimately there's been a lot of discussion on that. If you do have questions, we feel that it's best for you to discuss that consideration with your legal counsel. Will those in prison or jails be given vaccines at any time they are at high risk and are the government's responsibility? Yes, we are working with that population. That population is identified in phase 1B. And so certainly the prison members and the offenders that are within the prisons are eligible. It's a little less clear on where county jails come in, but certainly the prisons are within that 1B discussion. Do we offer information in Spanish? Dawn and Bethany, it seems that we do have some information available through CDC, but can you address that?
Yeah, definitely, Ken. Thank you. The emergency use authorization fact sheet that is given to individuals prior to receiving the vaccine are in 26 different languages. Those links are on our webpage, and you can go ahead and look up that information for each of those different vaccines.
And Dawn, let's go ahead and have you and Bethany address the next one. Will people know which vaccine they're receiving, and how will they keep track of that?
Yes, with the ancillary supply kit that Bethany was talking about, each healthcare provider is also provided a vaccine card. That vaccine card is filled out and given to each individual when they receive the vaccine. So on that card, it will specify if you received either the Pfizer or the Moderna vaccine. And then just as a reminder, you should come back and get that exact same brand or manufacturer of vaccine. That's what is recommended.
Thank you, Dawn. The next question is, I have elderly parents. They've talked to the doctor's office, and the doctor's office is telling them to call back next week. Wouldn't we expect someone to call them? That's a good question, and that's going to be so heavily dependent upon kind of where we are at. I would venture to guess, given the age that you've offered here in the question, we would expect those populations to be eligible through community clinics of some fashion. So I don't know that the physician's office will be in a position to call all of their residents, but as we get farther into vaccine availability and vaccine is more widely available, there may be opportunities for healthcare providers to notify their patients that vaccine is available. So just stay in communication. Again, keep an eye out for community messaging for vaccine that's available in your community for that elderly population. So Dawn and Bethany, a question here. Once the first shot is given, are we guaranteed the second shot's available?
Yeah, thanks, Ken. Everything that we're led to believe is yes, we will definitely have sufficient vaccine for this. The federal government is holding back a second dose for every first dose that we are allocating. So the federal government is releasing that second dose to us either 21 or 28 days later, depending upon that minimum interval for each of those different vaccines. So everything that we are receiving for information is we'll have plenty of second doses available to complete that series.
Great, thank you, Dawn. So the next question is, when do we best guess to be providing at least some vaccine to priority 1B? I am just so hesitant to give even a targeted date. We think it will be several more weeks before we have enough vaccine in the supply chain to vaccinate the 1A population. So we do think it will be 3 or 4 more weeks at least before we get to that population. But again, it is just too early to say until we have better clarity on the increase in vaccine administration. Yeah, so there's a question here with the Biden administration announcing they're going to push vaccine across the country and not hold back 2 doses. How does that impact your plans? We will have to sort that out. If that does suddenly double the amount of vaccine that we have, we'll have to think strategically to ensure that we have, plans in place to receive that vaccine, increase our eligible population, while at the same time also balancing planning needs to make sure that we have the ability to do a second dose. Dawn and Bethany, any additional context to add to that?
Yeah, to this point, Ken, everything that's been allocated to us is coming as that prime, that first dose, and then holding back that booster dose. So this would have to be a change that would come from the federal government.
Yeah, thanks, Don. So the next question, local health departments don't have capacity and or sitting on inventory. Why are they not working with local providers to get shots in arms? We are watching that very closely. We are not allowing local public health agencies to stockpile inventory. We are working every day that if a local public health agency does have extra inventory, we are working to redistribute that product to areas of the state that it can be used to reach that 1A population. Again, we feel it is very important that we prioritize the healthcare system to ensure that we are ready in the event that another surge of COVID-19 hits the healthcare system. And we feel it's important to get that population adequately vaccinated. And we think it's important to do that before we start vaccinating lower risk priority populations. So we are working very hard to make sure that vaccine is where it is going to be. You're right, many county health departments are stretched in terms of resources, and those local partnerships with pharmacies, large employers, healthcare providers, and hospitals will be vitally important to make sure that shots do get in arms when those shots do become available. The other thing I will remind everyone, the availability of vaccine is our biggest limiting factor to being able to advance ourselves through the vaccine priority populations. So there's some questions here. Supply issues exist. It sounds like there's still supply beyond our abilities to administer the vaccine. I don't feel that that is true. While we certainly are watching the vaccine come in, we are seeing every day the increase in the number of vaccines being administered. I do think that the holiday timing, anytime we have a brand new event, things are going to be a little bumpy until we work out the details. So I feel very confident that as we have increased supplies, we will see the improvement in the efficiency for which that vaccine is administered. The pinch points here again are we are working hard to get those priority populations vaccinated before we move through to the next population. So that is taking us a little time to drive vaccine where it needs to be to get to those priority populations in 1A. And then as we watch that vaccine supply, once it becomes available, there are approximately 1,700 enrolled vaccine providers across the state. To date, we have not used anywhere near that number of vaccine providers. So it is, I don't feel it is a matter of capacity. It is truly a matter of supply, and we will continue to work closely with counties to make sure that that supply is driven to the areas of the state where the highest priorities exist. The next question doesn't give me enough detail to respond to. My apologies. So is there a list of providers in the Cedar Falls or Waterloo area? Don had mentioned Vaccine Finder on the website. You can look that up. If you just do a Google search for Vaccine Finder, that will take you there. Don, is that populated now or it will be soon?
It will be soon, Ken. So as vaccine is available and those organizations turn themselves on as being visible to the population, it will be able to be seen there. Also refer you back to each county's webpage. You know, when they have vaccine and transitions, these different phases, I anticipate they'll be designating people to go to these different sites within their county.
Okay, thanks, Don. So can you please give examples of essential workers? And more specifically, where does law enforcement fall? Law enforcement and fire officials who are not EMS providers fall squarely in the phase 1B population, phase 1B. So law enforcement and fire department personnel will be among the next group that becomes eligible. As a non-educator, we need schools to be open full time. How do I recommend move teachers up? Yes, I will just acknowledge IDAC has recognized the importance of K through 12 teachers and staff, as well as childcare staff. We expect them to be within that phase 1B population. There's some acknowledgement of some of the challenges of the Walgreens and CVS that have been covered recently in the media. We are working closely with both of those pharmacies to try to address some of those concerns. If a skilled nursing unit and a residential assisted living unit are the same part of the campus, will the assisted living residents be considered in 1A? If you're an eligible part of the program, yes. What the pharmacies have been told is when you go into a campus, if you have that kind of all-encompassing campus, go ahead and vaccinate that population across the board. It makes sense to do that rather than coming back multiple times. Where do food service workers fall? It's expected that food service workers will fall in phase 1C. Educators are in 1B, yes. And to be more precise, K through 12 and childcare providers. Data center workers. Data center workers are not until we get into 1C or even beyond. I would have to go back and look at the ACIP recommendations. I would encourage you to take a look at ACIP 1B and 1C recommendations. If you just Google that, you'll find that information. Bethany, maybe this one's for you. Those that have already been COVID-19 positive, what's the guidelines for receiving the vaccine?
Absolutely. As long as they are through their infectious period and are feeling better, they can go ahead and have the vaccine at any time. We do know that most reinfections do not occur within the first 90 days after you're recovered, so they may wait to choose to be vaccinated towards the end of the 90 days. But once they are feeling better and through that infectious period, because we don't want to expose any of our healthcare workers, they would be eligible for vaccination.
Thanks, Bethany. Okay, I see we have right at 98 questions. I'm maybe about halfway through those, so I apologize. We're not going to get through all of the questions today. I think there's a theme emerging as we kind of get through some of these questions, so I hope many of these have been addressed in some fashion. I'm going to take just a couple of more. It looks like Director Garcia is still with us, so I may pause here with just a couple minutes left for her to give any closing comments. So a couple of additional questions I'll run through real quickly. Are all types of manufacturing facilities included in 1B? Yes, manufacturing facilities are generally included in 1B. The bigger question will be a prioritization based upon the risk factors, such as are you in congregate settings? Are there environmental factors that help keep distance between employees? So there will be some additional prioritization factors that need to be considered when you look at manufacturing facilities. City employees such as drinking water, wastewater, those are being indicated in phase 1C according to ACIP. Will it be clear who falls into phase 1B as frontline essential workers? So I think one of the things that we always hear is people want to see a list with their profession listed and where it is in rank order. Please understand that we just simply cannot do that. There are too many variables to get to that level of detail. And so what we will be providing, there will be categories of workers that are identified. Within those categories of workers, there will be, as I've offered some suggestions already, perhaps some sub-prioritization that we look at, for example, meat packing plant workers specifically, because of the nature of their work environment and because of the experiences they had with disease trends earlier this year. Beyond that, it will be factors like what have been the disease trends for that industry? What are the risk factors within that industry in terms of their work environment, the risk of exposure, the duration of exposure, and those types of considerations that will help you begin to prioritize your relative risk to your peers. So a lot of similar themes. So with 3 minutes left, I'm going to go ahead and take the liberty to stop the Q&A session so that we can end on time. We respect everybody's time and want to make sure that you can get on with the rest of your day. So we greatly appreciate that. Director Garcia, if you are still with us, would you like to make any closing comments?
Thanks, Ken. I think this was a lot of information today, and I'm sure a lot for our partners on the call to digest. What I would say in closing is that communication is key right now. We are not going to be able to get to everybody's individual specified question, but if you have broader process questions, you need clarity or communication help, we stand ready to assist you in that effort, and communication is key right now. So we definitely want you to have the information that you need so that we can move on down the line and get the rest of impacted Iowans vaccinated as quickly as possible. And Ken, great job. And team, great job on this information today. We appreciate our partners pulling this together.
Great, thank you, Director Garcia. Greatly appreciate that. There has been, there is a question as well here. What percentage of the vaccine received has been used? That is such an ever evolving number because the inventory is constantly coming in and the inventory is constantly being used. There is a CDC tracker website that you can look at that has a nice map that shows the allocations that the state of Iowa has received and the number of allocations that have been administered. So take a peek at that. Dawn and Bethany, help me out, or Rebecca, CDC tracker.gov.
I can post that for the question. What time are you at for that question?
3:49, Dawn.
I'll drop that link in there right now.
Great, thank you. So yes, there is a pretty good tracker out there. It's updated regularly at CDC. It feeds right out of the information from the state of Iowa. So there are some things that you can go and watch to see how well Iowa is doing. In addition to that, we will be posting, as I mentioned earlier, administration numbers for total administrations in the state of Iowa. That will begin on Monday. We will be updating that Monday, Wednesday, Friday on coronavirus.iowa.gov. So with that, thank you all very much. We come to 4 o'clock precisely here to go ahead and close and wrap up our event. We will be looking at additional venues like this. I do not yet have a date set for another venue. I do think that we need to obtain a little bit more information from our federal partners. We need to continue to watch that vaccine manufacturing. And at such point we feel we have more definitive information to provide to you, we will again work with our partners at Iowa Economic Development Authority, Department of Agriculture, and others to host another session. And so with that, I close with just a big thank you to our peers over at the Iowa Economic Development Authority for offering this platform. It's been a fantastic partnership. Greatly thank you all for your time and support as well. For the rest of you, thank you for your time. Greatly appreciated. Please visit some of the websites that we've mentioned. Check out the Iowa Department of Public Health website frequently and visit our vaccine website on that page for additional information. Thank you for your patience. Thank you for your understanding, and we will be back in touch in the near future. Have a good day.